Welcome back to our program, dear viewers. Today we will cover three main topics as follows. First, men should remember not to eat this before going to bed for healthy kidneys. Second, people with weak kidneys often sweat profusely in various areas. The more they sweat, the higher the risk of disease. Now let's move on to the first topic. Men should remember not to eat this before going to bed for healthy kidneys. Firstly, avoid eating salty foods at dinner to maintain efficient kidney function. We should limit salt intake, especially in the evening, because after dinner comes a long night of sleep, during which the kidneys work harder to detoxify accumulated toxins, putting strain on this organ. Secondly, do not drink too much water before going to bed. Many still mistakenly believe that drinking a lot of water before bed is good for the body, helping cleanse the intestines and support detoxification processes in the liver and kidneys. However, this practice only puts excessive strain on the kidneys, leading to increased metabolic burden, frequent nocturnal urination, and significantly reduced sleep quality. If this habit persists, the workload on the kidneys and the body will increase, and water will not be excreted in a timely manner, potentially causing edema and even impairing kidney function. Thirdly, avoid holding in urine. This habit, which many people still casually adopt, carries numerous hidden risks. Continually holding in urine weakens the bladder muscles and inhibits the body's signals to the brain for action. Over time, this can lead to urinary retention in old age. Urine also becomes a suitable environment for bacterial growth, causing diseases both within and outside the kidneys, such as urinary tract infections and bladder infections. Moreover, stagnant urine in the bladder can reflux into the kidneys, leading to infections or serious kidney damage. Indeed, soaking feet before sleep each night brings surprising benefits, especially for the kidneys. Fourthly, it's advisable to soak your feet before going to bed. There's a folk saying, "The rich have tonics, the poor soak their feet." Traditional Chinese medicine notes that under the soles of the feet lies the Tai Chi acupoint, where the kidney's vitality resides. Soaking feet in warm water and massaging the soles helps nourish the kidneys. Soaking for 15 minutes each night in this way ensures the kidney's vitality is maintained. Both mental and physical health will improve. In addition to caring for the kidneys during sleep, men can monitor kidney health through everyday activities. Although kidneys are deeply embedded in the body's core, making diagnosis challenging, they are directly involved in the excretory system, most notably through sweating. In the next part of the program, we will explore three common areas where people with weak kidneys often sweat, helping you detect and treat issues promptly. 2. Individuals with weak kidneys often sweat profusely in three areas. Firstly, the upper back. Humans have fewer sweat glands on their back, so in healthy individuals, the back sweats less. However, if a man frequently experiences sweating on his back, accompanied by cold chills, it should be a concern as it could indicate kidney issues. The reason is that weakened kidneys struggle to excrete toxins through urine efficiently, leading the body to eliminate toxins through sweating on the back. Secondly, the armpits. Normally, men sweat more in the underarm area during physical activities and on hot days. However, if you sweat excessively in this area, even with minimal activity, it could signal kidney disease. Weak kidneys cause the body to retain excess water and toxins that cannot be adequately excreted through normal means, forcing the body to use sweat glands in the armpits. Thirdly, the palms and soles. 2. Individuals with weak kidneys often sweat profusely in three areas. However, some men experience year-round excessive sweating in their palms and soles. This is closely related to kidney issues. If sweating in these areas is accompanied by loss of appetite, nausea, and bloating, it may indicate kidney dysfunction or weakness. Lifestyle adjustments, increased water intake, and prompt medical checkups are crucial before it's too late. Moving on to the next topic, the more you sweat in three specific areas, the higher the risk of disease. Dear viewers, we often hear that sweating is a way to detoxify and lose weight. Sweat indeed is the body's excretory product. However, excessive sweating can be a worrisome sign of illness on the body. There are three areas where increased sweating signals toxicity within the body. Firstly, excessive sweating on the back warns of potential health issues during vigorous physical activity. Sweating on the back is normal, and though it may be profuse, it dries quickly. However, if you're sitting still, not actively moving, or sleeping in a cool room, yet your back sweats heavily, that's an abnormal sign. It could indicate that kidney function is declining. At this point, the kidneys may not efficiently excrete toxins through urine, so they increase sweat production to compensate. 2. Sweaty feet. The liver, kidneys, and heart are closely interconnected. The soles of the feet also have many reflex zones related to the renal channels. If your feet sweat excessively without a clear reason, accompanied by frequent fatigue and weakness, you should be very cautious. This could be a sign that your kidneys are having issues, your liver is poisoned, or your heart function is deteriorating. 3. Excessive sweating on the head, loss of appetite, hyperactivity disorder, signs of diabetes. The head is an area where sweating profusely is rare, except when exposed to sunlight or during intense exercise. Loss of appetite, hyperactivity disorder, signs of diabetes. The head is an area where sweating profusely is rare, except when exposed to sunlight or during intense exercise. Hormonal imbalances, especially those involved in secretion and metabolism processes, can also increase the risk of diabetes. Doctors have observed that many prediabetic patients show signs of sweating on the head and loss of appetite, a consequence of disrupted glucose metabolism causing blood sugar levels to spike. Although not yet a serious sign of diabetes, if this condition occurs frequently and persistently, you should adjust your diet and lifestyle to balance blood sugar levels and stabilize metabolism. For example, reduce intake of white starch, use whole grains instead, cut down on sweets and overly sweet fruits like ripe mangoes, durians, and watermelon. As ancient scholars said, illness comes from the mouth. This is particularly true in health matters. Most ailments stem from what we ingest. In addition, here are 11 signs of kidney weakness in the body. 1. Swelling edema is a typical sign. When kidney function declines, excess salt and fluids are not properly excreted and accumulate inside the body, causing swelling. Swelling often occurs in areas such as the ankles, lower legs, hands, around the eyes. Pressing on the swollen area with your finger will leave an indentation on the skin. When swelling occurs, consider it a sign of kidney weakness and seek medical attention promptly. 2. Loss of appetite, not enjoying food. Loss of appetite and changes in taste are also signs of kidney weakness. The cause is the buildup of waste products such as urea, acid, creatinine that are not adequately eliminated, leading to bad breath and altering taste perception. Patients often perceive food as metallic tasting and lose interest in eating. Prolonged loss of appetite can lead to severe weight loss and body weakness. 3. Changes in urination habits. Weak kidneys can cause abnormal urine volume, either increased or decreased. Additionally, the frequency of urination changes, especially at night, with a constant urge to urinate. Some cases may include symptoms like painful urination or urine retention. These are observable signs of kidney weakness. 4. Nausea, vomiting. Nausea is a symptom of many illnesses and is also a sign of kidney failure that you should pay attention to. The cause is often elevated blood urea levels, which frequently cause nausea and vomiting, especially in the morning. 5. Anemia. Besides its function of filtering blood and excreting toxins, the kidneys also play a role in synthesizing erythropoietin. This hormone is involved in the production of red blood cells. Therefore, when the kidneys weaken, the synthesis of erythropoietin decreases, resulting in insufficient blood volume leading to anemia. Anemia often causes patients to feel tired, have pale skin, dizziness, experience chills, and even faint. 6. Foamy or blood-tinged urine. Foamy urine is a typical sign of kidney weakness. The cause lies in the damaged filtration mechanism of the kidneys, which allows protein molecules to pass into the urine, creating foamy bubbles. Additionally, the leakage of blood cells into the urine can result in urine that is brownish red, pinkish, or cola-colored. 7. Dry skin, itching. This is another sign of kidney weakness. The reason is that when kidney function declines, the ability to filter out toxins is compromised. Accumulation of toxins in the body can lead to itching, dry skin, and an unusual odor. 8. Difficulty breathing. A surprising sign of kidney impairment for many is difficulty breathing. The cause is the reduced kidney function, leading to excess fluid retention in the lungs, coupled with decreased oxygen levels due to insufficient red blood cell transport. This results in difficulty breathing even when the patient is at rest. 9. High blood pressure. There is a close relationship between kidneys and blood pressure. When kidneys weaken, excess water and salt are retained in the body, leading to high blood pressure with symptoms such as abdominal pain, blurred vision, and headaches. If diagnosed with hypertension, it is advisable to check kidney function because these two conditions are interconnected. 10. Asthma. The kidneys play a role in gas regulation. If the kidneys weaken, the ability to regulate gas decreases, leading to symptoms such as difficulty breathing, wheezing, and even asthma. When these signs appear, you should pay attention to your diet as follows. Limit salt intake to reduce the burden on the kidneys and prevent the risk of high blood pressure. Drink enough water to help eliminate toxins from the body. Control blood sugar levels to avoid the risk of kidney failure in diabetic patients. Maintain a healthy weight because increased body weight also puts pressure on the kidneys. Manage blood pressure as high blood pressure increases the risk of kidney failure as well as cardiovascular problems and stroke. Avoid smoking because it accelerates kidney damage. Build a healthy lifestyle by maintaining regular exercise every day, dedicating time to rest, maintaining a cheerful and optimistic mood, limiting stress. Always take care of your health and especially pay attention to your kidney health. Do not ignore any warning signs and seek advice and timely treatment from healthcare professionals. Health is our most valuable asset, so let's cherish and protect it every day. Thank you for watching and see you in the next videos on health and self-care. Goodbye and see you soon.